Okay, we're going to go over the musculoskeletal system medications. I want to note that you note that the ATI unit that will be covered and you to go over are chapters 28 and 29. Um, then you will see that also unit 9, chapters 30 to 33. So I want you to make sure that you know the key terms, identify the key features of the musculoskeletal system, discuss the importance of the healthy endocrine and nervous system to proper musculoskeletal functioning, then recall at least 5 musculoskeletal disorders and the appropriate treatment for each, and then discuss at least 4 bone and joint disorders and 1 appropriate treatment for each. And so we're going to go over start and state that muscles, tendons, and ligaments attach to the bones or joints. And a lack of calcium will affect not only the bones, but the muscular system. Now, the thyroid plays a big function, key function in this. It's a big involvement with the endocrine system and how it controls the deposit of minerals. Now, the thyroid itself produces the calcitonin and allows the calcium to remain in the bone. Now, the parathyroid gland which increases the calcium in the blood, the loss of calcium in the bones. So it actually helps it not leach for the bones, keeping the calcium in balance. Meds for the muscular disorders, you'll see a range from ailments to different etiologies. You have cerebral palsy, stroke, multiple sclerosis, and the ailments can be from injury or actually a disease of like muscular dystrophy. So, with that being said, they usually get treated by the antispasmodics like Skelexin, which is the metalexone, and then there's also the muscle relaxants that you'll see. The brand name usually is Flexeril, but is silobenzaprin, and then both work on the central nervous system. And they're classified as a benzodiazepines, so it'll show up in the drug test. So you have to make sure you have proof in your prescription bottle, because it also in the class of Valium, which is a diazepam. And then Zimpalt is actually a newer drug, which is a duloxetine. It is an antidepressant, and they've seen it helped a lot with the lower extremity pain, specifically the back pain, and it actually helps the well-being. The only thing, there's some side effects, the stomach. Different things. It does work for some people and doesn't work for others. So now there's also the Botox, which is the botulinum toxin and type A. And then there's also that Botox or the Botox cosmetic. And it is actually in high doses will cause a food poison, which is botulism. But also, talking about the Botox, it can treat very successfully the chronic migraines, limb spasticity, abnormal head position, which has been able to help. It's called cervical dystonia, and it's where the abnormal head position, and it actually will help to where you can actually do some physical therapy, and it won't be as painful. Then the chronic eye twitching, and then even people that have this condition that have excessive sweating, underarm sweating, it is shown to help that. Now, some things that has actually helped, they say, but it's not usually covered with the FDA approval, is tinnitus or tenderness, the ringing in the ear. So, more and more things they're learning about that drug there. Okay, so now we're going to talk about some more muscular disorders like the myasthenia gravis. You'll see that Lou Gehrig's. It's a progressive autoimmune disease that affects the skeletal fatigue and muscle weakness. It's the loss of the acetylcholine receptors, causing the breakdown in the communication between the nerves and the muscles. And it's a very sad and death, because what ends up happening, the muscles that involuntary muscles with that associated with breathing will eventually be affected, and it will actually you will suffocate. So with the treatment of myasthenia gravis, it's the cholinesterase inhibitors such as the neostigmatine and to facilitate the acetylcholine accumulation. And there's no cure, but treatment have caused the reduce the symptoms. The there has been, let's see, there's some Lyrica. It's an analgesic, anticonvulsive. It helps with fibromyalgia, shingles pain. And then that's contraindicated if you're using ACE inhibitors, because it will actually make you be very sensitive to that drug. And so also it causes extremity edema. I know we just kind of like jumped from myasthenia gravis to treatments of other muscular disorders, but I want to go ahead and move on to fibromyalgia. And really, that's always been labeled to a person that they haven't been able to find the etiology of what's going on. They think they may have just a hypersensitivity to pain. And so, but they're learning more and more about it. It's just basically it causes chronic pain with the muscle and soft tissue surrounding the joints. It's associated in the rheumatoid or rheumatological classification. Now, with the that being said, they actually, you treat it with Lyrica or anticonvulsive, but also with some medications that have been associated to use with it has been the same medications that they have been able to use, like with Elavil is also a blood pressure medicine, but it also helps with the chemical messengers that relay pain signals. So you were to go on. I'm going to go on and talk about the medications or the abnormal that treats the abnormal calciums, the hyperkalemia, and the low blood calcium. Calcitonin and Miacalcin is a nasal spray, and it's also an injection. It helps with the maintain the calcium levels, and it can come from a human form or some fish like salmon. So then you have the same disorder that this medication can help. It's the osteomalacia, which the adult form of rickets that they call in children, with the lack of the proper calcium in the bones. And then the osteoporosis, it's treated with vitamin D, hormone replacement therapy, by or Fosamax, that is shown to help. And sometimes it's linked to people that have a lack of exercise or too much exercise, the more the smoking, alcohol consumption, anorexia nervosa, estrogen therapy or testosterone deficiency, poor nutrition, or obesity. So you just have to, once it goes to the point of like osteoporosis, we just mentioned, it actually can have holes in the bone, and they're very easily to break. Well, now the Fosamax is proven to be very effective. Now, the Paget's disease is a disease that is a very, it's where actually a bone grows, and a patient reabsorbs bone excessively, but the new bone that grows is very weak and fragile. So they have it's treated with calcitonin, and then the bisphosphonates, which encourage strong bone formation. So now we're going to go to the meds for bone and joint inflammation. The table I want you to see for the types of arthritis. And there's osteoarthritis, which is erosion of the bone, that someone that's just overworked it or actually has been flaccid, just not done much exercise at all, can be from one extreme to the other. And then they say it's usually middle-aged to older. They've associated with similarities with the osteoporosis is usually postmenopausal. There is associations with that, and it can be treated with capsaicin. It actually, it's an analgesic cream ointment. It's from chili peppers. It derived, and so you have to really make sure you wash your hands and don't use it around your eyes, and get it in areas where it'll burn. Now, osteoarthritis and the rheumatoid meds, you see usually NSAIDs, because the NSAIDs are COX-1 and COX-2 inhibitors, and that's utilized because they say it's more effective. The only side effect with that is it's going to have you'll have issues with your stomach and cause peptic ulcer. Duodenum is another way you can say that, ulcers, because of the fact it's prohibiting the COX-2 that will actually, or COX-1 that will that protects the lining of the stomach and intestine. So now you will see the Advil, Motrin, Aleve, and that's usually in that family. Now there's the actually gout is a form of arthritis, so it's caused by a buildup of uric acid in the joints, but it's usually affects mostly men because of the uric acid buildup in the kidney. It affects that joint of the big toe or foot, and normally it's swells, very painful. Now, some women after menopause will have that, but with the medicine they use, also NSAIDs, and for maintenance, they also use the glucosteroids. But for maintenance dose post episode, it's the Xyloprim or the Feboxstat to lower the uric acid. So now we're going to go ahead and talk about the medications and the risk factors. You have people that have excessive alcohol use and hypertension, diabetes, hyperlipidemia, and atherosclerosis. Well, that's with the hardening of their arteries. They're going to be more affected by the different meds because they're already predisposed. But just know that the medications, when you have symptoms, note and always assess because it can cause GI bleeding. The NSAIDs with renal, they can cause renal or cardiac damage with long-term use. Aspirin is also NSAID with the COX-1 and COX-2 inhibitors. And they say that aspirin wouldn't have been cleared through the FDA, but they have found so many good things it does, but because it is so wide range of what it inhibits. Okay, topical medications, of course, containing the medications, menthol, celecoxib, thrombamine, azorbaline, and Bengay, Azihot, and Capacine has been helpful. But there are some things that, like I mentioned, that would actually absorb the which is the capsaicin. Now, technically, NSAIDs it actually decreases the production of the prostaglandins that cause the pain and inflammation. That's what they inhibit. By doing the COX-2 inhibitor, may increase the risk, though, for heart problems. And if you have any contraindications or any allergies to sulfa drugs, you do not want to use the COX-2 inhibitor NSAID. And that's usually like Celebrex. Now, it's a larger group. It allows the COX-1 enzyme to continue to produce the reducing GI irritation side effects. And then the NSAIDs blocking, including NSAIDs, including the aspirin, block COX-1 and 2, causing the GI diagnosis of peptic ulcers and the duodenum ulcers. Now, we're going to go into the disease-modified anti-rheumatic drugs. And usually you will see they're the last resort in anti-inflammatory drugs. And those include like the methotrexate that I had mentioned before, where you have to have a visual field every 6 months. It actually is really hard on the body. And then the Neural, and that's a cyclosporin. And then the azufidine, and that's a sulfa lysine. Then we're going to go ahead and talk about the asogalol, which is a gold derivative. It's given by injection or orally, but usually by injection to people that are newly diagnosed with rheumatoid arthritis, because it'll actually prevent joint damage and disability. But because probably the cost and the overall, they say the overall others work just as well, that it is not the first choice of medication for the newly diagnosed. And then corticosteroids, they're produced, and the hormone is produced in the adrenal gland. And so they basically mimic that. The only thing is you can only use it for a short time. If you go ahead and continue to use it, you'll get Cushing's. It's a moon face. You'll see that. And you have to just know that it does help, but it can cause a lot of other side effects. It is a great anti-inflammatory because it mimics that hormone, the cortisol, that your adrenal gland makes, but it doesn't mean that it's supposed to be constantly. What cortisol does also is causes you to have that belly fat and excess angioedema, just overall fluid. So you have to see how much the benefits outweigh the risk. Now, last but not least, we're going to talk about the phantom pain. Now, the phantom pain, usually with someone that's had extremity removed and amputated, they'll still have this feeling that there's something there. And all they have associated with is with nerve damage. And so, with that being said, they've tried the best to try to treat it. So they have tricyclic antidepressants have seemed to help, along with Elavil, which alters the messengers that relay the pain signals, and then also Pamelor. It does the same thing. Now, anticonvulsants such as Tegretol or carbamazepine, and these, I hate generic names, and then it slows the pain signal to the brain. And then, of course, there's the narcotics, which the morphine, which dulls the pain perception center of the brain. But that is the last resort because of the fact it is so habit forming. So overall, you want to definitely look over your terms and look at the practice questions in the back of the book are really good. And you'll see, we'll talk about that later. And we'll go on and cover the next chapter next week. But I want to really start doing group activities on some case studies associated with these chapters. So have a good evening. Thank you.